DMEK is really the premier treatment now for endothelial dysfunction. There's a lot of excitement about trying to get cells to regenerate in some of the Fuchs patients, and that may well turn out to be a good way to go. But right now, DMEK is still really the gold standard for both Fuchs dystrophy and for other causes of endothelial dysfunction. Now, why is it the gold standard? Well, number one, it gives us the best vision, and number two, we have less risk of immunologic graft recognition because we have less tissue that we're transplanting, and there's absolutely no stroma. Because there's no stroma, we have less risk of rejection. And that's important for another reason too. The other big important reason is that we can decrease and potentially stop steroids a lot sooner than we can with any of the other transplant procedures. That means we have less problems with glaucoma, and for those with glaucoma, less chance of the pressure going up. Now, some unique aspects of our course is that we put it together to improve pattern recognition, so that when you go in to do surgery, you have a better idea of what's going on and how you can avoid problems. So we start out with didactic, going through really in depth what's going on with these procedures, how to do them, what can go wrong. And then we do wet lab. We practice in the wet lab, manipulating the tissue, how to handle it, how to get it to unfold, and then we will see post-op patients, how to handle these, what's happened to these eyes. And then after that we do more wet lab. So this is designed to hear about it, do it, see more, do it again. And that's the first day. The second day we do live surgery, anywhere from 8 to 14 cases. We let you watch through the assistant scope to see exactly what we're doing, because we may not explain it exactly the way we're using the instruments or what's going on. All this continues to evolve. And then you have the option during these surgeries to go up and do more wet lab and come back, or wait till all the cases are done and then finish the rest of the day in the wet lab, so that you have the ability to really get your pattern recognition honed down for these procedures. Because our goal is that when you go home, you should be able to start doing these cases, and we try to make that happen for you. In some cases you can even stay longer and see the post-operative patients if you'd like to see how they look in the immediate period and how we handle those patients. But all in all, it's been very exciting to be able to change the way transplant surgery is done around the world. And if you're interested in improving your skills in these endothelial keratoplasty techniques, and in particular DMEK, then we'd love to have you come spend some time with us.